So today we're going to talk about respiratory acidosis and compensations. We first want to consider what respiratory acidosis is and what does that mean. So respiratory acidosis is the increase in carbon dioxide. So this increase in turn decreases the pH of the blood. And a lower pH means that the acid levels are higher. So just the opposite is also true if you have a high pH value. It will mean the higher the base level. So when we say base, we're referring to alkaline. So when the carbon dioxide increases or builds up, the pH level decreases, and this makes it too acidic. So under normal circumstances, our body does a great job of balancing the ions. And since the body does a great job of controlling this, you're probably wondering, why are we even talking about it? But there are exceptions. Respiratory acidosis is usually caused by an underlying disease or a condition. And these conditions are also referred to as respiratory failure or ventilatory failure. So the optimal pH of blood in the body is 7.35 to 7.45, and we refer to this as the normal pH. So when the blood pH goes or falls below 7.35 is when respiratory acidosis occurs. We have another term to look at, which is hypoventilation. So looking into this on a deeper physiological level, respiratory acidosis is the acid-base balance disturbance due to the alveolar hyperventilation. And remember, that's in the sacs, in the lungs. The production of carbon dioxide happens rapidly, and the failure of ventilation increases as the partial pressure of arterial carbon dioxide. So we write this in the symbols PaCO2. And the normal reference range is at 35 to 45 millimeters of hemoglobin. So remember, even though we're talking about the lungs, we're talking about what happens in the blood. And when we talk about compensation, this is the term that we use for restoring the pH to a normal level once this has happened. So in the kidneys, the renal system, it also helps us to compensate for high acid levels. The kidneys will start increasing the production of bicarbonate, and the increase of bicarbonate in the blood helps to restore the normal pH levels. So the best option for treating respiratory acidosis would be to control the underlying conditions that led to it in the first place. For example, illnesses that might disrupt breathing and the exchange of gases in the lungs. Sometimes physicians do treatments to improve the breathing. This often includes drugs that help open the passages so that the patient can breathe better. In acute respiratory acidosis, something called a BiPAP is prescribed to help with breathing. This is a non-invasive positive ventilation. This is done with a mask. In more severe cases, a tube is inserted into the airways for mechanical ventilation. The colored bars, when you look at the slide that look like a rainbow, are the different levels and colors that are universally associated with pH levels. So notice the acidic are on the far left from 0 to 6, with 0 being the most acidic. It gradually becomes less acidic as it moves to the right in the middle. The neutral pH is in the middle at a value of 7, and as the pH moves to the right, it becomes more basic or alkaline. So the values of 8 to 14 denote alkalinity. So the weaker or the less alkaline are the further to the right or the biggest number. If you've ever tested the water for a swimming pool, you'd be used to looking at these colors and how they relate to the different values. So what causes the increase in carbon dioxide leading to acidosis? Well, we know when we breathe, we take in oxygen and exhale or give off carbon dioxide in our lungs. So the oxygen is taken in and it passes across and over into the blood system. So while the carbon dioxide crosses coming out or being expelled into the air we breathe or out into the atmosphere. However, sometimes the lungs cannot get rid of all the carbon dioxide like it would under normal conditions. And this might be a decrease in the respiratory rate or some other condition that impedes the flow of the air. So various diseases can contribute to this, such as asthma, COPD, pneumonia, sleep apnea, and others. Or it could be due to drugs taken either prescription or otherwise. So other physical conditions, such as a condition with a nerve or muscle disorders that affect the lungs or can even affect your breathing. So even something as simple as holding your breath can cause the carbon dioxide levels to increase. I've included a diagram on this slide that I want you to look at, and it shows the normal bronchial tube in comparison to an inflamed bronchial tube of either, say, for instance, a COPD or an asthma patient. Just look at what I would refer to as the hole in the middle and how the overall volume of the air that passes through the bronchial is different. If you've ever tried to run, say while you have bronchitis, it might feel like how someone with asthma or COPD might feel all the time when they breathe. So the one on the right is the one that's almost completely closed in, and the one on the left shows a normal bronchial tube. So there are two kinds of respiratory acidosis. There is acute and chronic. The acute happens very quickly and it is a medical emergency. If this is left without treatment, the patient will continue to get worse and worse. It can literally threaten the life of the patient without treatment, and it could result in death. The other is called chronic, which means it happens slowly over time. It doesn't cause symptoms, and since it's slow over time, the body will adapt to the changes in acidosis. One way that this happens is that the kidneys release more and more bicarbonate to help maintain the balance. We might even say the kidneys were overcompensating for the condition. So while chronic respiratory acidosis may not cause symptoms when the body develops other illnesses or conditions, then they may cause acute symptoms to come on very quickly because there's already an underlying problem. And this leads to more acidosis and worsening of conditions. So there are things that can be done to prevent respiratory acidosis, and it's important, first of all, to maintain a healthy lung function. So if someone like myself, and you can probably hear me breathing heavier because it's really thick outside, has chronic asthma, it's important that they do everything that they can to ensure that their lungs are healthy by taking their medications, using their inhalers, avoiding environmental triggers that make things worse, and eating the proper foods. I have food allergies. If I eat foods I'm allergic to, my airways swell up, and that just counteracts the entire problem. And there are some medications like extremely strong painkillers, such as opioids, that reduce the respiratory function. So about a year and a half ago, when I broke the acetabulum in my pelvis, I could not take the amount of pain pills that they prescribed because it made my breathing too shallow. So if something else happens like this, it's important to know your limitations and take the smallest doses that you can. Tobacco use should be discontinued as it is strongly associated with COPD. Another thing people do not like to discuss is their body weight. So obesity makes it harder to breathe. It also increases other risks such as heart disease and diabetes. So even though we're discussing acidosis, I wanted to show you the difference between acidosis and alkalosis. So alkalosis will be covered in another PowerPoint, but any imbalance of the two can cause you problems. So the alkalosis side on the right has a decrease in carbon dioxide that leads to too much bicarbonate level in the blood. Both of these require you to maintain a healthy lifestyle, including staying hydrated. So everything I just said about alkalosis was actually just the opposite of what we just learned on acidosis. Okay, so now it's time for discussions and questions. And respiratory acidosis, we talked about, was a increase in carbon dioxide, and it results in lower pH levels. And once the pH goes down below 7.35, we consider this respiratory acidosis. We also stated the normal was 7.35 to 7.45. So that's what we consider the normal pH. And then we talked about hypoventilation. And then we talked about the various things that increase the CO2 in the body, from diseases, drugs, disorders, even holding your breath. We also talked about compensation, which was restoring the pH to a normal level, and how our kidneys help to do that by increasing bicarbonate levels in the bloods, and then the various things that our doctors can prescribe to help with that. So take just a few more minutes and let's have some questions. These are the different works that I cited for this PowerPoint.